Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress live Wednesday night podcast. We have been off the air for about 3 weeks after our 100th episode. We needed to regroup, and I have been traveling an awful lot for a little while, but we are back in action, and we have jam-packed shows till the end of the year and beyond. But tonight we are starting with something very important that everybody needs to hear about is open enrollment for Medicare and as well as Medicaid fraud. So I would like to not have a further wait and bring on our two guests tonight from OHA, the Office of Healthy Aging. So welcome, ladies, and thank you for taking the time for us tonight.
Thank you for having us tonight.
Yes, thank you.
I'm so excited to talk to you all tonight, but let's tell everybody who you are and what you do. Let's start with you, Christine.
Sure, thank you. Hi, everyone. Good evening. My name is Christine Anderson. I am the program manager / health informations manager for the State Health Insurance Assistance Program, which is called SHIP for short. This is a national program This is through the Administrator for Community Living. It's offered in all 50 states, actually 54 states if you want to include Puerto Rico, Guam, District of Columbia, and the U.S. Virgin Islands. This program is extremely important. It helps, the main goal and mission of the program is to help Medicare beneficiaries navigate Medicare. Medicare is very complicated, as many of you know. I find it complicated myself. And what this program does is it provides unbiased information and just educating individuals that are either enrolling into Medicare, turning 65, aging into Medicare, or currently on Medicare, and just helping them with their healthcare options and just navigating that whole process, and just letting them know what's available out there, especially right now with there being Medicare open enrollment, which started back in October 15th and ends December 7th. This is annual. This occurs, excuse me, this is when you can actually review your plan. We tell Medicare beneficiaries that it's very important to review your plan every year. Unfortunately, not everyone does. There was actually a survey that went out, a study that went out through Kaiser Family Foundation, that approximately only 71% of individuals actually review their Medicare plan on an annual basis. I'm sorry, 71% don't review their plan. So that is a huge number for people who do not review their Medicare plan, especially this is a Medicare, your Medicare plan changes annually. There's always during fall, around September, everyone who is on Medicare will receive an ANOC, which is called an annual notice of change, or EOC, which is evidence of coverage. And what this does is your current Medicare Part D plan or your Medicare Advantage plan will send this notice out to you, just letting you know your current plan, any changes that will be occurring starting in the following January of following the next year. I know a lot of people, unfortunately, do not review this notice that they receive. And if they do, it tends to be a little bit complicated to understand. And I know a lot of people just get flooded with Medicare information, so they might just see and toss it instead of actually reviewing it. But it's very important that you review it, because come January 1st, when you go to get your prescriptions or you go to the doctors, and then all of a sudden the costs have changed and you don't realize why, usually it's stated in that notice. And that's why it's important to review your plan during Medicare open enrollment. In our SHIP program, we have counselors that are located throughout Rhode Island that will help you just to review your plan, give you unbiased information. What you can do is you can contact our SHIP line for all locations. So that number will be provided. It's 1-888-884-8721. And that is, sorry, my screen just timed out. Okay, so that number is Rhode Island's statewide number. We have 6 partners throughout Rhode Island that have SHIP locations. But instead of providing everyone with those individual numbers, I'm just going to provide you with the SHIP line that I just provided, and you can contact us and you can let us know where you're located, and we'll let you know the closest SHIP location to you. And then from there, you contact them and you can set up an appointment. So just to let you know our SHIP locations as well, our partners are TRICARE Community Action Agency. That's North and South. We have Child and Family Services of Newport County. We also have West Bay Community Action Agency. We have United Way of Rhode Island, which covers statewide, as well as us as well. We have the Diocese of Providence that covers just Providence region. We also have East Bay Community Action, which covers the East Bay region. So those are our partners that offer SHIP services throughout Rhode Island. You can also contact us as well, and we do have SHIP counselors in our office as well that can assist you. So overall, it's just the main message that I'm just trying to get out here is to please review your plan. Like I said, your plan will change. If you don't want to go see a counselor, even though the counselors do offer in person or virtual or over the phone counseling, so whatever is convenient for you. However, if you want to try to do it on your own, this option is also available. If you go onto the Medicare Plan Finder on the Medicare.gov site, you can actually create your own account, or you don't have to create an account if you don't want to, and just do a general search. And with the Medicare Gov asks you, if they ask you for your prescriptions, if you don't make an account. If you do make an account, the system will automatically pull your prescriptions that you take, your most current prescriptions that you've gotten filled at the local or whatever pharmacy that you go to. The system will pull that information, so you can just update it and make sure that you're still taking those same prescriptions. And from there, you can actually review the Medicare Advantage plans that are available in Rhode Island. I think there's approximately 24 that are currently available for 2023. And those Advantage plans, the main companies for those is United Healthcare, Blue Cross Blue Shields, the Aetna program, WellCare, United Healthcare, and Humana. Humana is actually new this year. So those are the main Medicare Advantage plans. And then you also have your standalone Part D plans that also you can review for those of you that are in original Medicare. So there's approximately 24 different Part D plans as well that are offered. So either way, both of those options are in the Medicare.gov site. So you can go in and plug in your prescriptions. You can also search to see if if you're in a Medicare Advantage plan, if you're looking to switch, you want to make sure that your doctors accept those plans, because you don't want to enroll into a Medicare Advantage plan and your favorite doctor is not in the plan, does not accept that plan. So that will be a huge mistake. But You can check all this information out in the Medicare.gov. If you don't want to make an appointment with a SHIP counselor, there's also 1-800-Medicare. You can contact directly for assistance. Usually what will happen right now is most likely they will refer you back to us. But that is always an option to contact 1-800-Medicare itself as well.
Christine, I'm gonna stop you there for a second because you gave us a whole wealth of information.
Sorry.
So I'm gonna let everybody digest that a little bit, and I want everybody to meet Jennifer. So Jennifer, why don't you tell us a little bit about you and what you do, and then I can ask you guys a few questions to kind of break a little bit down of what you said, Christine.
Sorry.
Sure. Thank you, Tina. Thank you for having us tonight. It's a pleasure to be here. My name is Jennifer Reyes. I am the SHIP and SMP volunteer coordinator at the Office of Healthy Aging, which is formerly known as the Department of Elderly Affairs. So I do a lot of the recruiting of volunteers for both SHIP and SMP. As Christine mentioned, SHIP is the State Health Insurance Assistance Program. SMP is the Senior Medicare Patrol Program, which is also a national program for people with the Medicare of all ages and is also administered by the Administration for Community Living. The SMP's mission is to empower seniors to prevent healthcare fraud. And at the Office of Healthy Aging, we oversee the SMP program for the state of Rhode Island. Like Christine mentioned, there are 54 SMP grantees nationwide, and we have volunteers and staff throughout Rhode Island that help educate Medicare beneficiaries, families, and caregivers on how to stop Medicare fraud and prevent it from happening. So I'm going to pause right there. I don't know if you want me to continue.
Yeah, no, that's a good idea. One thing I want, like I said, I want to go kind of back and forth here because I want people to. I want to bring this down to a level where everybody can understand it. There's a whole wealth of knowledge. This is a complicated system. So I want to break it down a little bit. You guys are a wealth of information. You guys are the perfect people that we need to be talking to. Christine, one of the first questions I have for you is, what happens if somebody doesn't have a way to review, or if they don't get it in the mail, or how do they go looking for it if they don't have a copy of it?
They should contact their plan for that information. If they didn't receive it, the plan should be able to send that information back out to them.
Okay, so they should have received it already by now. So if
Yes.
you are at home and you do not have a copy of a newly printed copy of from your provider, call your provider, make sure that you get a copy. Is that the only way that they can get a copy, is from their provider?
Yes, unfortunately, yes. I don't know if they contact 1-800-Medicare, I don't know if they'll be able to pull that information, but the best bet is just to contact the plan. You're referring to the notice of change, correct? For their
Correct.
plan? Yes, yeah. The best bet is to contact their plan directly.
Okay, perfect. And Jennifer, this next question is going out to you because I know so many people are worried about fraud nowadays and getting something in the mail. Do they believe it? Do they not believe it? Because, there's so many different scams out there, especially for us seniors. How do they know if it's a real paper that they get from their actual provider, or what should they be looking for to not be scammed?
Yes, so now with open enrollment, there is a high level of calls and scammers trying to get a hold of these Medicare beneficiaries. If they're giving you a call and asking for any personal information, your Medicare number, your social security number over the phone, most likely it is a scam. If it's a provider, social security, Medicare calling on their behalf, they wouldn't be asking for any of your personal information. They have that on hand. So just make sure you don't, if they're asking for any information as far as your social or Medicare card, just make sure you don't provide that information. Any phone calls, I know that time of year, everyone's getting bombarded from early in the morning to late in the day. Just if they're asking for any questions and you're not sure, just hang up or tell them you're all set. You're all set, and you can reach out to either SMP to us at the Office of a Healthy Agent, or contact your provider and see if it's something that maybe they scheduled, or even your health insurance plan, just to be aware and make sure it's not a scammer.
Yeah. My best advice to everybody, never give your personal information over the phone unless you made the phone call. If somebody is calling you asking for anything, hang up and call your provider yourself, or call HA, the ship of the SMP program. Never give out your information on a call that's called you, because you don't know where that number is coming in from. If you actually call your provider, you have a better chance of not being scammed because you're calling them. Is that a across the board thing that you guys go by as well?
Yes. Yes. So we always recommend, do not treat it like a credit card. You're gonna want to share that information. So don't ever give it over the phone. Except for your doctor. If your doctor is calling, and most likely they wouldn't be asking for that information, we always recommend just give them your card or Medicare ID number in person in the office. Nobody should be calling you over the phone and requesting that information.
Yeah, just
Christine, yeah, go ahead, Christine.
sorry, I just want to add to one of the biggest scams right now is someone will contact a Medicare beneficiary and already have their Medicare number and their name and information, and they're calling just to verify that is correct. And they've been getting a lot of beneficiaries this way because they already have their information, so they're thinking that they're legit, and that is not the case. So please do not, if someone calls you with this information and just asks you to verify your Medicare number or your social or any of that type of private information, just hang up.
Again, if you don't make the phone call, do not give the information. That is your best rule of thumb. If somebody is calling you, say, I'm sorry, I will call you right back. And you will call your provider directly. Do not give out your information if somebody calls you, only if you make the phone call directly. Christine, what are some of the most important things or changes that are going on this year? Can you give us any insight of, like, what are some of the big changes going on this year?
Sure. So there's always different changes going on with the Medicare Advantage plans. They always try to come out with new benefits, whether it's hearing aids, new dental benefits, or anything like that that original Medicare would not offer. Um, so I know that's a big thing, but one of the biggest things is the cap of the insulin cost is going to be capped at $35. So that is was actually implemented by Congress for the Inflation Reduction Act. So that is going to be starting for January 1st. So that will make a huge difference for anyone with diabetes and the cost of those medications. So I know that will be a huge relief for some individuals.
What are some other ways that people can save, you know what I mean, by looking at their plan? I'm trying to give everybody, you know, why you should be definitely checking this. Like, what are some of the big places that you can save?
Sure. They said that the plans change every year. The tiers can change. You can have a tier one drug that's low in cost this year, but then all of a sudden it goes to a tier 3 or tier 4. Or if you're taking a new medication starting this year, and then the current plan that you're on right now might be a high tier, but if you review another plan and just review your options, you might find a plan that has a lower tier, that offers that drug at a lower tier level, which is a lower copay for you and lower out-of-pocket cost. So just just reviewing that. And then also the monthly premiums do change as well. You have, if you are looking at Advantage plans, pretty much all the companies offer a 0 monthly premium when it comes to Advantage plans. But however, you just got to be cautious with those, because even though it's a 0 monthly premium, you're still going to be paying usually more higher out-of-pocket cost. So just keep that in mind too with those plans. Unless you're considered a dual beneficiary, which is someone who has Medicare and state Medicaid. And you would be eligible for what they call a D-SNP plan, or a Medicare Medicaid plan, which is through Neighborhood Health. Usually you won't pay out-of-pocket costs because you're on a certain income level. But for all the other plans, usually just keep an eye out for premiums. Usually the higher the premium, the less out-of-pocket costs you will occur, and vice versa. And then you just want to also review for additional benefits as well, and just make sure that all your prescriptions that you're currently taking are going to be in your current plan. And if they're not, then you definitely want to review a plan just to make sure that they cover all your prescriptions. And then just keep in mind, you're not locked into this plan. You can always review next year as well during open enrollment. So this is something that you should do every year. Tina, you mentioned what other options there is for cost savings as well. I just want to bring up two Medicare assistance programs that would be helpful for people who are considered low income. There's the Extra Help program through Social Security Administration that helps with your prescription copays. That is also an option. So please, if you have not been screened to see if you're eligible for this program, please contact us so we can screen you just to make sure that you're eligible for this program. Because if you are eligible, you'll see a considerable difference in copays. You'll be paying like $4 for a copay, sometimes $0, depending on what level you are on for eligible for this program. There's also the Medicare Premium Payment Program through the Department of Human Services, which is a state program. And this program helps to pay for your Medicare Part B premium that's deducted from your Social Security check. So this is an also excellent program if you're eligible for this program as well. The state will pay for your Part B, so you'll get a little extra money in your check. So also, please feel free to contact us to see if you're eligible for this program as well.
Yeah, those are great. And I'll tell you, I've always had a good thing with GoodRx as well. It's a great savings program. It's GoodRx. You can talk to your CVS or Walgreens pharmacy, and they can hook you up with that. And that always helps out with the cost of your prescription. So there's many, many ways that you guys can all save. Jennifer, though, what are some of the big red flags that people need to be looking out for that can really catch them off guard?
Yeah, some of to go back, I do want to say a lot of people wonder, how does it affect me? But it does affect everyone at the end of the day, because Medicare loses billions of dollars. So all these claims and proper claims, people just need to be alert, protect their information, detect any Medicare fraud, review their statements. So Medicare does mail out a statement every 3 months. So just review it, make sure the services you received from your providers match up with what's on the statement. And we also provide healthcare trackers to individuals, Medicare beneficiaries, so they can keep track of all their appointments or any labs that were done. And then that way, when they receive their statement, they can match up and make sure everything is there. They're receiving the services that were provided and were stated. Um, some of the things going back, don't give out your Medicare number except for the doctors. Don't carry your card unless you really need it. And just be cautious of offers. Sometimes you'll receive mail-in just or a phone call offering you free medical services or supplies. And it sounds too good to be true. So just be very cautious. If your provider is not ordering a supply or an equipment, then most likely it's not legitimate. So always just question. If you have any questions and you have any doubts, just contact your provider. Contact us at the Office of Healthy Aging, um, and we can go ahead and look at that for you and investigate any claims or fraudulent claims happening.
One suggestion I'd like to give to everybody is you do get a benefits review every 3 months. So what I usually do is when I go to the doctors, I keep all of my receipts with me so I know what procedures I had done, what blood work I had done, what prescriptions I had done. And when that statement comes in, I take all of that and I attach it to the statements. So at the end of the year, when I go for my review, I have 4 statements all stapled together with everything I had in those periods. So if I might have missed something, when I go in for my review, they can review it and they can catch it before it gets too far. So that's always something that you can do. Or if you have a family member that, come over once in a while to review this, it makes it easier for both of you not to catch something, because everything is stapled to the benefits that you should have received in that month. So that's always a way to, and it's also helpful when you go for your review because they see what you're having done. They see, right in front of you so they can help you pick the best plan. I suggest you use somebody to do this because I'll tell you, it gives you a headache just looking at the website on your own. So I highly suggest using somebody that sees this every day than trying to do it on your own. But like Christine says, how do we do it on our own if we choose to?
Sure. So you can go to the Medicare.gov, the Medicare Plan Finder, and you can have the option to either create an account or you can just do. If you create an account, it will save your information for you, so it'll be easier to go back to. If you just do a general search, it will not save that information. So every time that if you go back, you'll have to enter all your prescriptions in again. And you can review your plan. So whether you're on a Medicare Advantage plan, and you want to stay on a Medicare Advantage plan, you can compare your current plan with the new plans that are coming out for 2023. But if you are on a standalone Part D plan, you can also review those plans as well to make sure that plan is the best option for you. And usually it automatically lists it as the first plan that you see is usually the best plan based on the out-of-pocket cost and the monthly premium. So it will give you the total annual cost so you can see what the difference is.
Great. I'm going to go to a live question. One of the people were asking, Christine, this question is going to be for you. Are the blue chip stores part of this program? Is that what you're talking about seeing somebody in person?
So no, they're not a part of this program. The blue chip stores will only tell you about their Blue Cross plans. So if you don't want to hear about any other plans besides Blue Cross, you're more than welcome to continue going there. However, if you do want to hear about other plans other than Blue Cross, then your best option is to go to a SHIP counselor because they're unbiased and they're going to give you all the information.
Okay, so Blue Cross, is that not where everybody wants to be, or they kind of want to like do plans across the board?
So yeah, so Blue Cross might not be the best option for everybody. Everyone's different based on what you're taking, based on your doctors. So if I have Blue Cross and Jennifer was my neighbor and said, oh, I want to go to Blue Cross too because my neighbor had it and she doesn't pay that much out of pocket, and it could be different for Jennifer based on what she's taking.
All right. Okay, that makes sense. My second question is for Jennifer. Jennifer, how do we trust the statement in the mail that it's not coming from a fraudulent place?
Usually it will come from the Medicare, since it's for Medicare. So you'll see the logo, or you'll get an explanation of benefits from your insurance company. So it's Blue Cross United or whichever plan you have, or a statement from your provider, from your direct provider. Um, and if you have any doubts at any point, you can always contact the number, or contact SMP or your insurance plan just to see if it's a legitimate document.
Okay. Is there anything else that we should be looking for that will keep us safe? Because if you're saying that they can mail out something, how do we know that the number on that paper will not be our provider? Jennifer, I'm asking you this one.
Sorry. Just if you have questions, if because it could be a fraudulent document, just review the information on the statement and make sure it's either services that you were received. Usually it would have a date of the service that was provided, the information on the doctor. So just make sure everything is accurate. If anything looks off, um, contact your provider and just double check. Hey, I received the statement from your office. I don't recall this. It's always good to ask questions. Or you can also contact law enforcement if it's something you see that
Right.
looks suspicious or fraudulent as well.
Yeah. Well, I guess my interpretation of this question would be, if there's a phone number on a fraudulent paper that comes in, it's a list of providers that we could go and get a direct number to the provider. Because if we're unsure of the letter and there's a phone number on that letter and somebody happens to call that, is there a direct list where we can get all the providers' actual phone numbers in case we're questioning a paper that we get in the mail?
Um, no,
Oh, you should always use refer to your card, your plan card, because there will be a customer service number on the back of that card that you can contact. Worst comes to worst, you can always contact, like I said, Jennifer mentioned us, or also 1-800-Medicare as well, because 1-800-Medicare will have all that information on when you had a service done. We will not have that information. So if you don't want to contact your plan directly, your best bet would to contact 1-800-Medicare just to verify that service was done.
So your card is your best bet. Make sure you're turning to your card to make sure you're calling the number off your card. If you are confused or you are unsure that a letter in the mail is maybe not for you or your letter, or could be a scam. So always refer back to your card. Now, with our elderly and our disabled population that are using these cards, you had mentioned that it's not appropriate to carry the card with you at all times. Well, with everybody and systems changing so quickly, how do we avoid that?
So if you know you have a scheduled appointment, then yeah, you want to take your card and provide them with the information. But if you're just carrying it on a daily basis in your wallet, you can put down your wallet, lose it, and then it creates an issue. So if you're going to the pharmacy, picking up a prescription, going to your doctors, then that is the best bet to carry your card. Any other time you normally wouldn't need it, so you should keep it in a safe place.
Good advice. I know. Here's another question. Thank you for the shout out for our red bag system. RAMP has a red bag system that carries all of your medical information on you at all times, because for somebody like me who suffered a stroke while I was driving, thank God I had my medical card on me because they knew how to get in touch with me. What do you do in cases like that where you have to carry the card because you could have a medical episode at any given moment and you would need that card?
Just continue to review your statements. Monitor, make sure nothing weird is on the statement. If needed, um, just be alert every time these letters are coming in the mail, your statements. Just review it or have somebody review it just to make sure um, nothing fraudulent is going on. If you need to carry your card.
Christine, can you give us a few places of where in and around town, how accessible, how many places are there? Are they easily accessed off a bus route? If people are considering going, how accessible are these places in and around the state of Rhode Island?
So there's some that are accessible, like United Way, because that's in Providence. Usually the Diocese of Providence is accessible. Let's see. Child and Family Service of Newport County. We have 2 locations that usually serve child and family services, mainly the Edward King House in Newport. So that's pretty accessible. What else do you have? Tri-County. Tri-County has it's North Providence, so I believe that's on a bus route as well. But like I said, if you contact us and find out where the nearest ship location is to you, and you find that it's not accessible and none of the locations are, we will try to accommodate you, whether it's over the phone, virtual, or one of us will come out to your house if you're okay with that, or meet you somewhere that is accessible to you so we can assist you.
That is an awesome service that you do, because, with so many people, especially the disabled community with mobility devices, having an issue getting out and about on our buses and taxis or MTM or whatever, having that available that you could do it virtual or having somebody in person come to you. What an incredible service that you guys offer. Is there a charge for that? I know that's going to be my next, I beat you to it. I knew that was going to be my next question. Is there a charge to have somebody come out to your house?
Absolutely not. None of our counseling should be charging you. If someone charges you and they claim they're a ship counselor, please contact us immediately, because no one should be getting charged. It's a free service. It's supposed to be a free, unbiased service that we offer.
Now, see that we just caught another fraudulent thing. If somebody is charging you, they shouldn't be charging you. So if they are, they're not actually counselors that you need to be talking to. Is there a way of giving the person that you're meeting a picture, an email, or a way of description so they know who they're looking for, so they can feel safer? With everything in the world, you're meeting strangers. Is there a way that you make it safer for people to know who's coming out and meeting them?
So we don't require that, but that information, if they feel comfortable, the ship council will provide that information to them with no issue.
That is incredible. I know there's a handyman service that does that. They'll send you a picture of the technician that's coming out to see you. I think that is like the greatest thing going, because they will text you his picture so you know who you're looking for. So if somebody does not look like that, as long as they update their picture, because we did have one where the guy lost like 150 pounds. It didn't look like the picture that they sent us. So yeah, we questioned it, but that's a great idea and a great service. Jennifer, is there any things that you can think of on the fraudulent end that people should be looking out for if they were to meet somebody or go to a store? Is there something different there other than calls and email?
Um, just IDs too. We usually, or the ship counselors usually carry a badge. So just make sure, you can ask to see an ID. Yeah, we usually present ourselves well. Um, but that's
Yeah,
all I can think of for now.
yeah. You guys are fantastic. Christine, now that we're nearing the end of our show, I'd like you to sum up in a 1 to 2 minute time frame why everybody should be reviewing their statement. Just give us another overview, like you did at the beginning, why they should be, contacting you guys and reviewing their statements.
Yes, certainly. You should be contacting us, especially right now, because of Medicare open enrollment, which ends on December 7th. This is the time to just view your current plan, whether you're in a Medicare Advantage plan or a Part D standalone plan, just to make sure that you're in the correct plan based on what you're taking, based on to make sure that your doctors are still in the network. And also just to see what other like I said, if you're an Advantage plan, there's different benefits that come out every year, so you might want to switch your plan because another Advantage plan offers better benefits than your current plan. But mostly you should just review your plan, just to make sure it's still cost efficient for you, and just to make sure that everything is still covered by your current plan. This is not the SHIP program doesn't just offer this service during open enrollment, they offer this service year around. So whether you know someone that's coming on board for Medicare and just trying to navigate and just figure out what they need to do, we're available. Or just general questions that someone might have, that's on Medicare, they can feel free to contact us. Um, Also, we're also available to, I know several people who don't qualify for state Medicaid anymore, and because they're becoming eligible for Medicare, so they need to navigate that process and they're losing their Medicaid. So please free to contact us for assistance as well, because just Medicare is just overwhelming. And that's what the SHIP program is here. We're just here to guide you and provide you with unbiased information, just help you and try to make Medicare less complicated and easier for you and your family members and your caregivers to understand.
That's fantastic. Jennifer, tell everybody in a 1 to 2 minute statement what they should be looking out for Medicare fraud.
Yeah, just remember, always protect your information, detect anything suspicious, and report any fraud, errors, or abuse that you may come across. If you ever fall a victim of Medicare fraud, you're not alone. Contact us. We can walk you through the whole process. And also, if anyone is interested in becoming a SHIP or SMP volunteer and you want to educate other individuals about medical coverage or Medicare fraud, reach out to us. We're always looking for volunteers who are willing to give back to the community. And we can walk you through the process of becoming a volunteer.
That is great. I want to thank you, ladies, for taking the time tonight. Again, oha.ri.gov is where you would go to find out all things about all of their programs. So oha.ri.gov is the website you want to use. The website and the phone number is in the comments below from this thing. But I want to tell you guys both again, thank you so much for taking the time to telling us all about Medicare, Medicaid. It's so well informed, so informative, and I look forward to working with you ladies going forward in the future. So thank you again for taking the time tonight.
Thank you, Tina.
It was a pleasure.
Thank you. Thank you. And I want to welcome everybody back next Wednesday night, same time, same channel. Since November is National Caregivers Month, we will be talking to the 10-10-30 campaign with my favorite person, Nadine Cornish, next week. And we are talking about kids caregivers, kids who are helping carry a family member, a brother or sister, a grandparent, or whatever, the unrecognized caregivers, the children. So tune in next week to learn all about our kid caregivers and how we can support them in the future. So see you next Wednesday at 7 o'clock. And as I always say, don't just sit there, everybody. Make a difference. Have a great night.